In this video, we'll discuss how dry, cracked lips can point to digestive dysfunction and why you should address this. Enjoy. Welcome back, everyone. I'm in Seattle on a family vacation, hence the background. So if there's some extra background noise, though, my apologies. I'll do my best to get those sounds out in the post-editing process, but it is what it is, living here for a week. So in any case, today we're talking about the mouth, but specifically dry lips. I've mentioned this in some of my videos in the past, but we have to remember that the mouth is an earth element feature. It relates to the central cogwheel in the 5-element theory. Now, if you look at this facial map, you'll see that the lower lip is gray. This relates to the large intestine. Then the upper lip is this sort of pink color that relates to the small intestine. And then you'll notice the stomach and the spleen is here on the sides, and the stomach energy is on the upper lip. So you can see that around the mouth, there's a lot of digestive stuff going on. The geography of the mouth and the area surrounding it has very real ties to our digestive system. So I want you to think that this terrain on the outside, okay, the upper lip and the outside, the energy there is going to impact the lips to a degree. Now, the reason I tell you this is because when we look at the lips, people will think, well, we're looking at the large intestine and the small intestine, but touching the neighboring geographies are also the spleen and stomach. So this just paints the larger picture that the digestive system has very real ties to the presentation of the mouth. If the mouth, the lips, are very dry, and we're seeing a lot of peeled lips, a lot of cracked, deep lines, and it's chronic over long periods of time, this is an issue, and we have to start paying attention to the large intestine and the small intestine. And what this really is signed for, and a signpost for, is if the outer representation of the organ, okay, that in this case, the lower lip and the upper lip, we're looking at the large intestine and small intestine. If this geography becomes dry, that is an external marker saying the inside terrain, the internal connection is also dry. And as such, it's manifesting here. This is why the face is a two-way street and why we can use health diagnostics and face reading. If we understand the geographies, then we can look sort of to the source of where the problem is coming from. So when we have this dryness, what we'll usually see with people who have very cracked, dry lips, some of the syndromes that can come down the pike are constipation, people that have a very difficult time with their bowels, or they have intermittent bowels where maybe they'll defecate consistently for a couple days, and then they won't go for 4 or 5 days. Now, you can be constipated and not have this. It's never a direct cause. But when the lips are showing that, we have to start looking in that direction. The other thing that we can see is sometimes absorption problems. So if the lower lip or the upper lip is very dry and very cracked, then we're looking at those organs essentially being dry, which means they're not extracting and not hydrating appropriately. Now, what that means and how that manifests, there's a lot of syndromes in Chinese medicine, large intestine syndromes, small intestine syndromes. Again, I don't want to do a deep diagnostic. My job, I feel like, when I'm educating about this stuff is to put general parameters on your radar so you have a direction to walk towards. Pay attention to your small intestine. Pay attention to the large intestine. Do a little reading about what these things do in your body. Do a little digging on functional medicine and why small intestine function is so critical to the body. You have to remember that I think it's like 95+% of our serotonin is produced in the small intestine. And I believe 80+% of our immune system is also built in the small intestine. So if that starts to become dry or dysfunctional, the basis from which our immune system responds and the basis for feeling good, serotonin, right, the feel-good chemical or hormone, that's compromised. So when we see these dry lips, you want to pay attention to it. And I also want to address that if you have dry lips occasionally, this is nothing to worry about. It doesn't even mean that your large intestine has become temporarily dry. We all get dry lips. When I go to Tucson, I used to go train Kung Fu at my headquarters school in Tucson, Arizona with the North American Tong Shidao Association. When I would go there and train, the air was dry. I would get kind of like bloody noses and my lips would get really cracked. Environmental impact is not the same as chronic internal manifestation. So just make sure that you're paying attention to those two things. And if you are seeing dryness here, that does bridge and kind of chafe into the upper lip or into the sides. And sometimes you'll see this. You'll see redness kind of move down into the lips here or the sides of the cheeks, or you'll see like the peeling skin start to go up here. That means whatever pathology is in the mouth, this large intestine and small intestine, is also bleeding and connecting into these other organ systems. But these are the things that you want to pay attention to. Again, I don't want to sit here on a face reading video and give you medical advice, because this is not, and I can't give you medical advice because I'm not a doctor. But again, pay attention to these organ systems. Start reading about what they do in your body, and then I think functional medicine is a great way to go and find someone who is good at what they do. Start taking the supplements, start doing the protocol, start changing your diet, because if the digestive system goes out, again, the central cogwheel to the 5 elements is the earth element and the digestive capacity. That's the center cogwheel from which all things grow, move, and change. So if that goes out, or you're having trouble there, the other 4 elements flanking it, surrounding it, are also going to have problems, and therefore life force is diminished, health goes down, and you're not nourishing life appropriately. And that's what face reading is about. We should use this as a method and as an approach to tackle our health problems earlier rather than later. All right, y'all, take care.